Good afternoon. I'm Tony Monaco, president of Tufts University. I'm pleased to welcome you to this afternoon's event as part of the Tisch College Distinguished Speaker Series featuring Dr. Anthony Fauci. It's great to have so many members of the Tufts community joining us virtually for this conversation. I'm grateful to Tisch College for hosting Dr. Fauci and to the Tufts School of Medicine, the Fletcher School, and the Department of Political Science for their support. For the past year, the COVID-19 pandemic has reshaped every institution in American life, and our university has been no exception. It has been a formidable challenge to find ways to fulfill our educational mission while protecting our students, faculty, and staff, and safeguarding the public health of our communities. Through it all, it has been invaluable to rely on the expertise and guidance of Dr. Fauci during moments of profound crisis, often exacerbated by contentious politics. His steady leadership has been vital. Dr. Fauci has come to personify the importance of doing good science, communicating that science effectively, and putting it at the center of policy decisions that have the potential to shape and even save American lives. Dr. Fauci probably needs no introduction at this point, and his professional accomplishments are too many to name, so I hope he'll forgive me for being brief. Dr. Anthony Fauci is the director of the National Institute of Allergy and Infectious Diseases at the U.S. National Institutes of Health, a position he has held for 37 years. He oversees an extensive research portfolio focused on infectious and immune-mediated diseases. As the longtime chief of the NIAID Laboratory of Immunoregulation, Dr. Fauci has made many seminal contributions in basic and clinical research and is one of the world's most cited biomedical scientists. During his more than 50 years working in public health, he has advised 7 U.S. presidents on HIV/AIDS, malaria, tuberculosis, Ebola, Zika, SARS, H1N1, COVID-19, and respiratory infections. Throughout 2020, Dr. Fauci was a member of President Trump's White House Coronavirus Task Force. Since January, he has served as the chief medical advisor to President Biden. During the COVID-19 pandemic, Dr. Fauci became one of the most trusted medical voices across the nation for his clear and calm explanations regarding COVID-19, its risks, and the mitigation steps necessary to arrest the spread of the disease. His leadership during this pandemic has made him a national treasure. Moderating today's conversation with Dr. Fauci is Alan Solomon, Dean of the Jonathan M. Tisch College of Civic Life. Alan is a lifelong jumbo who was a Tufts undergraduate, a visiting instructor, a university trustee, and founding board chair of Tisch College before becoming dean of the college in 2014. He previously served as national finance chair of the Democratic Party, chair of the bipartisan board of directors of the Corporation for National and Community Service, and as United States ambassador to Spain and Andorra. As dean of Tisch College, he leads the college's mission to prepare a new generation of young people to solve problems in their communities, to participate in our democracy, and to help create a brighter world. Tisch College has strong partnerships with the Tufts Schools of Medicine, Dental Medicine, Nutrition, and the Cummings School of Veterinary Medicine. Tisch College's service learning programs, public service internships, and many other opportunities for students to engage in civic life are a key part of our mission to educate health professionals who excel as scientists and as leaders ready to address tomorrow's crises. Thank you, Alan, for your leadership of these efforts. We are grateful to host Dr. Fauci at Tufts, albeit virtually. Before I hand the program over to Alan, we believe Dr. Fauci's service to our nation merits special recognition. On behalf of Tufts University, I am honored to present the Presidential Medal to Dr. Anthony S. Fauci in recognition of his long and distinguished career in public health. The Presidential Medal was established in 1976 during the presidency of Jean Mayer. The Presidential Medal is one of the highest honors that the university bestows on individuals for particularly meritorious contributions either to the university or to society. We felt, given that Dr. Fauci has many honorary degrees, that the Presidential Medal was an appropriate way to express our special recognition of his contributions to public health and civic life. Thank you for all you have done to advance public health throughout your career, especially during these challenging times. We'll be sending the actual medal to you following today's event, but here it is, and I'm glad to show it in person, at least that I have it here, and it's a real honor to give it to you, Dr. Fauci, and we look forward to presenting it to you in person. With that, I'll turn it over to Alan to kick off the conversation. Thank you.
Thank you very much, Doctor. Thank you very much, Tony. Dr. Fauci, congratulations on this award. I can't tell you what an honor it is to welcome you to Tufts, especially on account of an important connection you have to this university and its medical school. Dr. Sheldon Wolf, who hired you at the National Institutes of Health, later became the chairman of the Department of Medicine at Tufts Medical School. Shelley Wolf was a beloved member of the Tufts community, and I understand that he was the best man at your wedding and the person that you once described as your professional father and your closest friend. I'm told you visited Tufts over the years, always sharing your knowledge and insights with Dr. Wolf's colleagues. So let's start the conversation there. We have many Tufts medical students in the audience today. Tell us how you were influenced by your mentor, why you chose a career in science and public health in the first place, and what advice do you have for students who are thinking of a career like that?
Well, first of all, thank you very much, Alan, for this wonderful honor of the Tufts University Presidential Medal. I truly appreciate it and am humbled by it. And, you know, apropos of your mentioning, and I'll discuss in a moment, Shelley Wolf, Shelley would have been very, very pleased to see this, I can assure you. Because as I've said publicly before, he treated me very much like his professional son, and this would have been particularly pleasing to him. You know, starting off with my getting involved in medicine, I think people get into careers for a variety of reasons. I got into medicine, and I think the original reason for my getting into medicine was probably shaped where I have gone in the middle and later part of my career. I started off, as you know, I went to Holy Cross. I went to Regis High School, which was a Jesuit high school in Manhattan, New York City. And I got very interested in the classics and the humanities, particularly studying, you know, the human species as opposed to human physiology. I was interested enough in science and biology and chemistry that I had this dual desire, one, to do something that was intimately connected with people, the suffering of the human species, the joys of the human species, but I also was very attracted to science. So there was no other profession that I could think of that would combine both of those, and that would be the profession of medicine and being a physician. So that brought me into being a physician. I did my typical training, as I'm sure all of your students do. Went to medical school at Cornell University Medical Center, now Weill Cornell. Did an internship and a couple of years of residency. And then I was interested in determining if I could have any talent or desire or aptitude for science. So I went down to the NIH in a combined infectious diseases and immunology fellowship. And I was fortunate enough, thank goodness, to fall into the sphere of Shelley Wolf, which I think to the younger people who are listening to our conversation, the importance of having a really unselfish mentor who cares about you and your career. Because that not only is good for you personally, it'll set an example so that you will then be very conscious of the importance of being mentor to other people, younger people, when you reach a certain level of achievement in your own career. Shelley essentially adopted me into the world of science because I was a very well-trained physician in a very good residency training program. And I didn't really know much about science, but I really wanted to learn. So Shelley, again, took me under his wing, was my mentor, but put me on a project in a very unselfish way, a group of patients that he had been accumulating, trying to develop a good therapy for his patients with inflammatory vasculitides, Wegener's granulomatosis, which is now polyangiitis with granulomatosis, polyarteritis nodosa, hypersensitivity vasculitis, and said, I want you to study these patients and we'll do it together and then I'll give them to you. And it turned out that we developed which were life-saving therapies for what were formerly fatal diseases. So he put me on a highly successful project and made me the principal person in the project, which was totally unselfish, because if he really wanted to, he could have made me kind of the gopher boy to do it for his thing. But he said, I want you to think about it. I want you to take care of these patients. I want you to think of therapies for them. And we did it together. And it was a highly, highly successful endeavor, bringing 93% remission rates to diseases that had 100% fatality. Mm-hmm. I would not have been able to do that had it not been for my mentor, who launched me on that and gave me the opportunity to make mistakes, to do it right, to do it wrong, but to finally get it right. And he launched me on my career. So I think that's the lesson of the day for younger people who are listening. Get a good mentor and be a good mentor.
Fair enough. Of course, you had some exposure to science and healthcare as a youngster growing up in Brooklyn. Your parents owned a pharmacy and you used to deliver the drugs to patients, as I understand it.
Yep, on my Schwinn bike with a little basket.
In 1981, though, you dropped what you were doing to study a disease that was unknown, and because it was mostly afflicting gay men, it was largely ignored. The story of your battle against HIV/AIDS is an extraordinary one. Initially, it stirred up anger from its victims and indifference from the medical establishment, but later you would describe as the only true and great hero among government officials in the AIDS crisis. Tell us how you went from a bench scientist to a public health activist.
Well, again, speaking about lessons for the younger people who might be listening to this conversation, the lesson is, and I'll tell you what happened, but let me give you the lesson first, is when opportunities come your way, even though you didn't plan them, examine them for the possibility that you might want to jump on that opportunity and maybe modify what had formerly been a relatively well-planned course. Because some of the most important things that happen in your career will be just happenstance things that come your way, that if you're alert enough and prepared enough, you might use it as an opportunity to do something important. I was at the NIH for a few years studying these diseases that I mentioned a moment ago that Shelley introduced me to, the inflammatory vasculitides. I was extremely successful in it, in that we had therapies that were now essentially curative, if not high remission rate. I was prematurely and luckily got to be very well known in the sphere of immune-mediated diseases. I was very young at the time, in my late 20s, early 30s at the time. And I saw the first MMWR, Morbidity Mortality Weekly Report, of 5 gay men from Los Angeles who presented with a very unusual pneumocystis pneumonia that stoked my curiosity because I was the infectious disease consult at the NIH. I had been there for several years. I was board certified in infectious diseases and in clinical immunology and allergy. And I thought it was a fluke. And then a month later, in July of 1981, the first cases was not June of 81, was July of 81. I was struck by another MMWR, this time of 26 young men, curiously, all gay, very strange, all with no prior underlying disease, who were presenting not only with pneumocystis, but with Kaposi sarcoma and opportunistic infections. And I looked at that, and was the first time, as I've described it multiple times, I actually got goosebumps. And I said, oh my God, we are dealing with a brand new infection, because I've been studying infectious diseases for the previous 9 years, and I had never seen anything that even approached this. And we knew it was an infectious disease, but we didn't know what it was. We didn't have the etiologic agent. And I decided I was going to change the direction of my career completely and stop studying these vasculitic diseases and devote my entire time to admitting these very sick gay men. I had a great deal of empathy for them. I have always had very good relationships in the sense of friendships with gay men. And I was very comfortable with dealing with them, which at the time there still was a lot of stigma back then. So I changed the direction of my career. And my great mentor, Shelley Wolf, on a phone call to me said, Tony, what are you doing? He said, don't give up your day job. He said, because this might actually go away. And that was one of the few times that he was actually not correct, because not only did it not go away, it exploded into historically one of the worst pandemics we've ever had. So having said that, your question about the activists, I was very visible because I was pushing the envelope, trying to call attention to this, because the Reagan administration at the time did not use the bully pulpit to sound the alarm that this was an emerging outbreak. We didn't even have any idea at the time about what was going on in Africa, which was even much worse than what was going on in the United States. And so, as I was the face of the federal government, the activist community got very concerned that we were not including them in the discussions about what the direction of research was, the timing, the regulatory aspects, all of the things that now are commonplace. So they picked me out as the face of the federal government and started to be very confrontative, theatrical, iconoclastic, storming the NIH, hanging me in effigy, calling me a murderer. And I said, wow, if they feel that strongly about it, maybe I should find out what really their issue is. So as the rest of the scientific community ran away from them because they were very intimidated by them, they would come down, dressed in crazy costumes and shutting down highways in Wall Street and St. Patrick's Cathedral and things like that. So I did something which was probably the smartest thing I have ever done in my career outside of scientific things. And that is, I said, let me listen to these people, because put aside the theatrics and just listen to what they were saying. They were making perfect sense. I said to myself, if I were in their shoes, I would feel exactly the same way they did. How can you have a clinical trial with an exclusion criteria that keeps people out who need to be in it? How can you have a clinical trial that's going to take 7 years when at the time you first had clinical symptoms, you had less than a year to live? Things that we were very rigid. I have to admit, the regulatory community and even the scientific community was very rigid. So I sat down with them literally in this room that I'm sitting here right now when they came to demonstrate at the NIH. And rather than have the police arrest them, I said, why don't you bring up a handful of them, 7 or 8 of them, to my office to talk. They were dumbfounded. They had never had a federal official who only wanted to arrest them to actually invite them into the office to talk. And that started a dialogue that to this day is still going on, because right now we've totally embraced the activist community. They're part of all of our committees, our community groups, our advisory committees, our councils, and they were totally value added to what we did. Only because of that day, I decided to listen to what they were saying rather than running away from them.
So the revolutionary change that you made was you listened.
Yeah.
Thank you. And you've been the face of the federal government then for longer than some of us might appreciate. But let's talk about some of the other pandemics you've dealt with. As a director of the National Institute of Allergy and Infectious Diseases, now for 36 years, you've dealt with a procession of viral epidemics, including HIV/AIDS, but also SARS, avian influenza, swine flu, Zika. President Monaco mentioned them before. In what ways is COVID-19 different clinically from these other pandemics? And in what ways is it different as a threat to the public's health?
Well, each of the outbreaks have some degree of commonality, some more than others. But it's the differences that are really striking. For example, HIV being a sexually transmitted disease that's behaviorally driven in so many respects, sometimes without even realizing it, innocently, without knowing that there's anything going on that's wrong, except you're just having a sexual relationship. There are ways to prevent that by not putting yourself in risk positions. Then there's Zika. It depends on where you live, where there are a lot of mosquitoes. Not much you can do about it, but try to stay away from the mosquitoes. Then there's Ebola, which is one of the most deadly diseases ever, but it's only transmitted from a person who is obviously very sick, so that somebody's not going to get on a plane perfectly healthy spreading Ebola, whereas somebody can get on a plane with influenza, sneezing and coughing a bit, and you wind up getting influenza. Putting all those things together, COVID is completely different than anything I've ever had any experience with. First of all, I refer to it when I used to get asked over the years, 20 years ago, 10 years ago, 5 years ago, Tony, what's your worst nightmare as an infectious disease guy, as a global health expert? What keeps you up at night? And I would always say a previously undescribed virus that we have no experience with, that jumps species from an animal to a human, that has two conflating characteristics. One, it's extraordinarily efficient in spreading from person to person by the respiratory route. And two, it has a high degree of morbidity and mortality, either generally or for some groups of individuals. And it turns out that in January of 2020, my worst nightmare came true. And we've been living it for over a year because we have a disease that's spectacularly effective in spreading from person to person, that is confounding because it's the only disease in which 30 to 40% of the people who get infected have no symptoms at all. And yet it can dramatically kill so many other people. 525,000 people in this country have died. 2.5 million people have died worldwide. We have 28 million infections in this country. And yet some large proportion of people don't get any symptoms at all. Never seen that. Usually a disease that can really kill 500,000 people makes almost everybody a little bit sick. But that's not the case with COVID-19 and SARS-CoV-2. And the other thing that to me was the great confounder that we now appreciate is that anywhere from 50 to 60% of the transmissions occur from a person who has no symptoms to someone who's uninfected. There are some infections that have a small proportion are transmitted from asymptomatic people. Most of the transmission is from symptomatic people. We didn't know that in the beginning. And what we learned, to our surprise and our dismay, that more than half of the infections are transmitted from people who have no symptom, which make it extremely difficult to do adequate identification, isolation, and contact tracing, because of the under the radar screen spread of an infection. And that's referred to as community spread. And that's what we see.
But when you first realized that you were dealing with your worst nightmare, did you imagine that it would get this bad with over 500,000 deaths and 30 million cases, an economy in lockdown? And how might the story have been different had the federal government responded differently when the coronavirus first began to spread?
Well, in answer to your first question, even though I'm a realist and I always tend to watch out for the worst case scenario, I did not imagine that a year later, the globe, the planet would be locked down for a year, the economies would be destroyed, and we would have half a million deaths in our country. I mean, no chance in the world if you had asked me that. What do you think is going to happen with this new? Remember, today's March 8th, I guess. March 11th is this anniversary of when we shut down travel from Europe, which is generally considered the anniversary of the outbreak in the United States, even though the first case was on January 21st. The real explosion of cases didn't start occurring until March. So at that time, I thought at worst, we'd have a bad rest of the winter. And then as we got into the warm weather in the summer, things would calm down a bit. Never would have thought that the summer had a worse surge than the previous winter. I never would have thought the economy would have been shut down, not only in the United States, but globally. And that's really where we feel. This is truly historic in its proportions, in that we have not had anything that even approaches as bad as this in over 102 years since the historic influenza pandemic of 1918. You know, even if the government did everything perfectly well, we still would have a really serious problem, no doubt. Take a look at the other countries. We had a double whammy against us because we had an outbreak in the middle in one of the most divisive times literally in the history of our country. I mean, unfortunately for us, I feel badly for particularly the younger people, because they may think that this is always the way it is. It isn't. There were times when there was, political differences, but not such great divisiveness that the different groups hated each other. That makes it very difficult to do something together. The common enemy is the virus. And when you have a common enemy, that's the only way you can attack that common enemy, is when everybody pulls together. You don't want to get too melodramatic about it, but the metaphor is that it's a war. It's like our being as war, and the Army doesn't particularly like the Navy, and they're doing things differently because, of particular ideologies that they have. Instead of saying, by the way, we have to defend the country together, let's do it together.
So how can public health officials adapt to this new political landscape? And is there anything the rest of us can do to help?
Yes, I think we have to be clear and articulate and rational in our public health guidances, our guidelines, our advice. And we are battling something that previous public health officials, at least in my younger days, didn't have to. Like maybe 100 years ago, in whatever was going on back then, there was the kind of divisiveness we see now. But right now, the idea of the complete distortion of reality is something that is mind-boggling. How so many people can have a reality distortion syndrome that, when you're a scientist, it's sort of antithetical for what you stand for. It becomes particularly more difficult to accept when you're in the field of science, where it is essential that you have good rigor in getting to the truth and the facts.
Well, speaking of getting to the truth and the facts, you've advised every president since Ronald Reagan, both Republicans and Democrats, before Donald Trump came along. How did Trump compare to the others, and what kept you from quitting, given some of the indignities that you experienced? And how's it changed working for our new president, President Biden?
Well, I don't really want to rehash the Trump administration because it speaks for itself. But it was obviously not an easy situation when you have, anecdote be considered with equal weight as scientific data. That becomes very difficult. I did not like at all the fact that I had to, under certain circumstances, contradict the president. I had nothing against the president. In many respects, when you're with him every day, he has some likable characteristics. He does.
You are two New Yorkers, right?
Well, no, I mean, that's the truth. I say that, and it's the truth. I mean, he has some characteristics that are quite likable when you get to know him. But, sometimes when he said things that were just patently not scientifically correct, I didn't take any pleasure in contradicting him, but I had to do that. And then that created the tension between us that got worse and worse as the year went by. And then you heard things, the fire Fauci and the Fauci's wrong and things like that, which you're asking me why I didn't step down. I felt that it would leave really a vacuum there that would have not as many people who'd be speaking the truth and talking on evidence and data. And I thought if I did leave, I would make matters worse. Now in a totally different situation with the Biden administration, it's very clear that science does rule and evidence and data really determine what we do.
Well, I think we're all grateful that you stuck with it even during more difficult times. Let me ask you some practical questions that affect many people who are watching. When do you think we'll see most children back in school, learning in person full time? And what do you think will get us there? Can surveillance testing play a role? And what are the knowledge gaps that are pertinent to reopening K through 12 schools?
Well, there are clinical trials right now that are either in the middle of or ending, which are going to get enough data that you're going to have high school students very likely being able to return to school in the fall term. That's the first thing. We're doing age de-escalation studies in elementary school students. That likely will not give us enough data on safety and immunogenicity until I would say, reasonably speaking, the first quarter of 2022. So just think high school kids back in the fall, elementary school kids. When I say back, I don't mean back in school. I mean, they're going to be back in school for sure. I mean vaccinated. So high school students being vaccinated in the fall, elementary students being vaccinated in the first quarter of 22. Hopefully, the level of infection will be down such that all children will be back in school within a reasonable period of time, hopefully by the time we get to the fall term and maybe even in the spring term coming up now.
Well, many people have set that as a goal, even here in Massachusetts. Do you think that is realistic and safe?
I think it is. I think as we get more and more people vaccinated, as we now have the relief bills signed, the $1 trillion, a lot of that is going into addressing COVID-19, including help to the schools to allow them to more safely bring the kids back. So I would hope that we would get most of the children back to school in a very reasonably short period of time. And by the time we get to the fall term, we'll feel very, very comfortable about it.
So let me ask you a personal question. My daughter wants to get married a year from this summer, in the summer of 2022. Are we going to have to wear masks to her wedding?
I don't think so. I think by that time, provided we don't have a variant surge and we get most of the people vaccinated, when you get the overwhelming majority of the population vaccinated, the level of virus in the community gets so low that the risk of infection is going to be minuscule. I believe that we can get there by the time your daughter gets married. The same way is that if we continue to get the level of virus down now in March and April, that would make it much more safe and comfortable for the teachers and the students to get back to school this coming term.
Yep. It's recently been reported that neighborhoods in the city of Boston that have been the hardest hit by the pandemic also have the lowest vaccination rates. And these neighborhoods are predominantly Black and Latino. I'm sure this is playing out similarly in cities across the country. What do we need to do to correct this inequity?
Well, equity has been now the hallmark goal of the Biden administration. He's made it very, very clear that in everything we do with COVID-19, in therapeutics and in vaccines, equity has to be the top front burner for us. So what he's doing is that he and we realize clearly that brown and Black people have suffered disproportionately getting infected and getting severe outcomes. Also, when you look at the numbers, they're getting vaccinated less. A couple of reasons. Some of them is vaccine hesitancy, but some of it is vaccine accessibility, not hesitancy. So put hesitancy aside and say, what can we do about the accessibility? And that's what the Biden administration is doing, is developing and standing up community vaccine centers, as many as 450, 500. Several of them are already up in neighborhoods that demographically are weighted towards brown and Black people. Getting drug to the pharmacies, particularly those in the neighborhood where there are brown and Black people. Getting mobile units to go out into not easily accessible areas to get vaccines out there. Establishing a task force on equity, having equity in the White House, and also having a task force chair, an African-American physician, Dr. Nunes Smith from Yale. So there's a lot that's being done to see if we could close that gap of equity when it comes to vaccines.
I want you to know, Dr. Fauci, that we have an audience of about 4,000 people watching us this afternoon, and we're going to go now to the audience for a couple of questions. I think we have 3 students who are lined up to ask questions, and I'm looking for Jeff.
Yes, thank you, Dean Salamont. Hi, Dr. Fauci. My name is Jeff Savarino. I'm a current 4th year in the MD MPH program here in the School of Medicine. My question is a perfect transition from what you just touched upon. The COVID-19 pandemic has really resulted in public recognition that people of color have long been affected by structural racism and health inequities. And I want to know what we can do both as clinicians and as a healthcare system to better address these issues to mitigate the disproportionate effect of both chronic and infectious diseases within this population.
Well, there are 2 things you can do. One immediately, and one is a commitment that you should not forget. The immediate thing is to make sure in what you do, in accessibility, resources, how you reach out into the community, that you do whatever you can as a health official, as a physician, to provide access to and go the extra mile to get access to people of color. But there's something that's equally as important, and you mentioned it. You know, the structural racism that you talk about leads to social determinants of health that were here from the time many of the brown and Black people that you're dealing with were born. You know, where they live, the economic disenfranchisement, the dietary lack of accessibility of good diet. You know, diabetes, hypertension, obesity, chronic lung disease, kidney disease, they're not all racially determined. they're determined by the social determinants of health. So you're a pretty young guy. You got a lot of decades to go. To turn that around is going to take decades of commitment. So maybe what we should do is make sure you and your colleagues have corporate memory enough to know that when this outbreak is over, the negative type of social determinants of health are still going to be there. And it's going to require a decades-long commitment to get rid of them. So go for it.
So I think we have time for one last question and brief, but let's go to the next student.
Hi, Dr. Fauci. My name is Sue Min. I'm from Orlando, Florida, and I'm a junior studying community health here at Tufts. Throughout the past year, new information about COVID-19 has emerged, and concurrently, existing information has changed over time as well. In regards to effective public health messaging on a national and maybe global scale as well, how did you decide what and when to communicate with the public?
Well, you have to continually communicate with the public. And one of the things that was really been a challenge for us is that this is not a static situation. It is really a dynamic situation where you have changing amount of information as it evolves. So what we knew on January the 10th, when the virus went on the public database, and January 21st, when we had the first case in the United States, and then into February, when we saw that there was community spread, and then into March and April, when we found out that it was spread by people who weren't infected, public health messages changed according to the data that we had. So as a public health communicator, what you got to make sure you do is that you speak based on the data as you know it, and you're humble enough and modest enough to change that when the data tells you that a recommendation or a guideline needs to change.
Well, I guess that the ringing you hear must be a signal. I want to thank you, Dr. Fauci. It's been a great privilege for Tisch College and for Tufts University to host you today. I think the presidential medal that was presented to you earlier expresses the very high regard that this entire community has for your work, for your service to our nation and to the world. I want to show you my regard for you. I have this, in Fauci we trust. I went to the website searching for Fauci merchandise. I could have got a bobblehead, but they were back ordered, so I got a mask. So I want to thank our audience for tuning in. I want to remind them that we have more events coming up. We'll be joined on Thursday by Fox News anchor Chris Wallace, next Monday by former Secretary of Agriculture Dan Glickman, and you can access the entire schedule at tischcollege.tufts.edu/events. And let me say, I guess I feel a little poignancy because Shelley Wolf really would have been proud of you today and to have heard you address the Tufts community of which he was a part. So I just want to give you a very special thank you from all of us.
Thank you very much, Alan. I appreciate it. Thank you for having me.
Thank you.